Thanks, Dale, and thank you to everyone for joining in. For those who don't know us, the Manufacturing Safety Alliance of BC is a not-for-profit health and safety association for manufacturers and food processors across the province. We invite you to call us for confidential help with your safety program in response to COVID-19 or any health and safety challenge. And visit our website for safety training and resources or information on the Occupational Safety Standard of Excellence program, known as CORE for other sectors, and which is enhanced for manufacturers and food processors. Today's webinar will talk about what you need to know to reopen your manufacturing or food processing business safely, or to ensure your people are protected and your essential business stays open. In today's environment, many of the key questions require medical expertise to answer. So I've invited a medical health officer from Vancouver's Coastal Health to join me this morning in a discussion of the key factors you need to consider to protect your workers as we slowly reopen the BC economy. Our guest today is Dr. Michael Chuan, a public health physician with a strong interest in health equity, healthy environments, and the social determinants of health. Michael is passionate about links between urban form and health outcomes, including active transportation and injury prevention. His work experience has taken him across Canada, as well as several sites in East and Southern Africa. He completed his undergraduate degree in biopsychology at the University of British Columbia, his medical degree at the University of Manitoba. Michael earned his master's at the Harvard School of Public Health and completed his residency in public health and preventive medicine at the University of Toronto. Today, Michael is a medical health officer for Vancouver Coastal Health. Welcome, Michael. Can you please start by telling us about the role of the health authorities during this pandemic and your role at Vancouver Coastal Health?
Oh, certainly. And thanks for having me. Good morning to everybody who's tuned in this morning. In terms of Vancouver Coastal Health's role, there's a number of things that we're doing from a public health front, and a lot of those include the on-the-ground work of trying to reduce the onward transmission of COVID-19 in the community. So at the most direct level, that involves getting testing done, so people who are at risk or having symptoms of COVID-19 being tested in a prompt manner, and then doing the case isolation and the very strict case follow-up, contact tracing, and in turn isolation and testing of contacts to help limit ongoing spread in our communities. And then specifically, we're also looking at outbreaks that we've seen, so large clusters of cases in contexts that do include workplaces, including long-term care, and in some cases food processing plants, and other places where people congregate by the nature of their work or their lives. And those outbreaks have their challenges, but also great opportunities for the prevention of ongoing spread.
Thanks, Michael. What are the critical factors in keeping workers safe in a manufacturing or food processing plant?
Well, there's a few different layers of that I could talk through. I think that at the very most important that we like to stress is that making sure that workers are empowered to stay off of work when they're sick, that they have that instruction and the ability to, whether that's through policies that give them sick time, whether that's through support and creating a culture of not working when sick within the workforce, or other things that leadership can do to support that. We spend a lot of time talking about personal protective equipment, which is very important. Distancing, also very important, but the person who is sick and not in the workplace can't transmit illness. So the absolute utmost thing is making sure that people are supported and instructed not to work when ill. Whether that's with clear symptoms that might be related to COVID, like a cough and fever, or sometimes the more subtle symptoms. We sometimes have people who have bad fatigue, they have muscle aches, and sometimes those people can end up developing worse symptoms and being diagnosed with COVID-19 as well. Within the workplace, once, although some people may arrive at work with low-grade symptoms or with symptoms that they haven't noted, or even develop symptoms over the course of a day, we want to make sure that there's good physical distancing in place where possible, and we've all heard a lot about that in discussions from our provincial health officer. Personal protective equipment that we could talk more about to limit the spread between people who might need to work closely together by the nature of their work can also have a role. So these are some of the layers that we would like to see implemented in workplaces. I really like to stress that it's a multi-barrier method. So no one of these measures is going to carry the day on its own. We really need to combine these different measures to be effective. And different workplaces will have a different mix of interventions depending on how for example, a plant is arranged. It could be a case-by-case basis. There's no one-size-fits-all plan.
Thanks, Michael. If you could talk about some of the more or most important considerations for employers to help keep the virus out of the plant, what would your thoughts be on that?
Yeah, coming back to the issue of people working while they might be sick or being able to communicate illness onward, of course, it can be initially a stress or a change to add procedures to make sure that people are off of the line when they're sick. But having worked with facilities that have large outbreaks, I can tell you that the stress of having, in some cases, dozens or more workers simultaneously off of the line because of illness and being isolated at home is a much bigger stress. Of course, no one wants to see an operation closed entirely for even a day, let alone many days at a time. So all of these things are definitely an upstream investment to making sure that work can continue. I think that the policies of really being supportive of employees being able to disclose symptoms and get off of work when they need to are really crucial. We found in some cases that people are even reluctant to let the employer know of symptoms, and I think that a policy that really celebrates when someone's made the decision to go off because of symptoms that they've decided that they call and say, I need to stay home today because I woke up with a bad cough. I think that really establishing a culture within leadership and between employees of celebrating that, and we're doing it here at the Health Authority too when somebody calls in sick, really saying that's the right thing to do and making sure that they can do that without fear of any impact on income or unemployment in the longer range. So that's, I think, one very important thing. In a specific way, screening people right at the point of entry for illness can be quite helpful. I think that actually proactively asking people about the different symptoms, all of us might show up at work and if asked, might say that we felt fine on arrival, but if asked, very closely in a direct fashion, are you experiencing any fatigue this morning? Do you have a runny nose this morning? Have you been coughing in a specific way? A lot of the time that does, in the course of a busy morning, most of us just get out and pilot ourselves to work without necessarily stopping and doing that assessment. So proactively asking the employees, screening them on arrival can be a very helpful thing. And we have found that when people are given that opportunity to say, yes, in fact, I have had symptoms and are screened out, that's very helpful. So that's one thing that we recommend.
Excellent, Mike. Thank you. What are the most important things employers should be telling employees?
Well, I think that the awareness of what are some of these symptoms of COVID-19 is very important. I think that initially most of us have thought of it, and overall it's reasonable to think of this as flu-like in its symptoms. The classical symptoms do include fever, do include cough, and I think that if you're being wary of those signs, that will go a long way. Being aware of the whole spectrum of symptoms, though, is important. We do have people who never develop the severe respiratory symptoms, but in fact have just what we call constitutional symptoms, overall feeling quite unwell. And many times people have that illness, but can still transmit infection onward to people who have a much more severe illness in some case. So we're making sure that the team is educated on, whether that's through posters or information that's distributed, asking about symptoms every day, letting people know of that is, I think, very important. And I think as well, making sure that the fear factor is dealt with. This is an infection that we've come to learn more and more about, although we know, unfortunately, it can be quite severe, particularly for people with pre-existing medical conditions. The large majority of people do have mild illness that passes in time. And so I think just getting good information out there, when we have really a sea of information being distributed on COVID-19 in the world right now, the employer can have an important role as a trusted source for good information. And those are things that Vancouver Coastal Health or your BC Centre for Disease Control are trying to provide.
Thanks, Michael. Certainly there is a lot of information on COVID-19. Can you explain how transmission happens and how it doesn't?
Oh, definitely. So the main ways that transmission of COVID-19 happens is through what we call droplet transmission. So these are droplets from the respiratory tract. So these are things that are coughed, sneezed, or otherwise make their way out of someone's mouth or nose. And this could be directly, and it's unpleasant to describe, but it's true. It can be directly onto a person being coughed on or sneezed on, and also onto surfaces that another person touches. So if we're sitting across a table from each other, one of us coughs on the table and another of us places our hands there, the subsequent act of touching our mouth, nose, or eyes, which is very natural over the course of a day to do, can transmit the virus from our hands into our face. So these are the main ways that this is transmitted. The ways that it's not transmitted include just by more distant contact, by airborne transmission. There's some concern about airborne transmission in the hospital context, where people are having intensive medical procedures, what we call aerosol generating medical procedures. So if somebody is intubated or procedures like that, but for the workplace context or for a social context, if people are more than 2 meters apart and just breathing and talking normally, it shouldn't be transmitted in that way. And as long as we're washing our hands, it's not transmitted by touch per se, but it's really if someone has their hands contaminated and then brings that to the ports of entry in their face, again, their mouth, nose, and eyes. That's one way that the virus can be transmitted.
Thank you, Michael. How does the health authority respond to a COVID-19 positive test in a production facility? What does the inspection process look like? And the key requirements to decide to close a facility or when to reopen a facility where there has been a virus outbreak?
Okay, yeah, I can have, from a few experiences we've had with outbreaks, I can walk through that a little bit. And I think that the first thing that we try to do is really work with the operator, let them know that we're there as a support, is the first thing. I think that it can be pretty frightening knowing that there might be a case or even many cases in the facility. So really trying to make sure that we're there, that it's clear that we're there to give good advice, and make sure that transmission doesn't spread and to get things back to normal as soon as possible. And the way that we do that when there's a case is very quickly trying to interview that person, having a public health nurse or physician like myself talk through in detail when did the person's symptoms start, and then during the relevant days, what were the contacts that they had. So those could be people that one worked very closely with, also people who had what we call the sort of social workplace contact, like lunchroom contact, we sometimes say, with, because that can also be a source of transmission. The way that the threshold that we look at for the most part is if two people were in a 2-meter bubble for 15 minutes or more, that's really an area that at the time that we see as potential transmission. And we have seen transmission even between people who say, well, we didn't really work closely together and we didn't spend much time, but we did have a conversation about process XYZ. That's been enough in some cases for a transmission to occur. So I think that that sort of hallway conversation, for us, that's a check mark, and we would follow up with that contact and make sure that we monitor their symptoms in turn very carefully. So from the employer's perspective, the way that this can look is that a number of people might be asked to stay off of work, quarantined for their incubation period of the disease, while we either have them tested or wait out the duration of the incubation period to make sure that they don't become symptomatic with COVID-19. So this can mean a number of people being off of work for a time. But again, we see this as quite protective because these are all people who might have been exposed, and if they're working silently infected and transmitting, a lot can be lurking beneath the surface. And we've sometimes seen when we get to an outbreak later that there's been, even without a lot of people having severe illness or going off of work sick, that there's been widespread transmission before even a single case is noticed, because symptoms can in many people be so mild. And then in terms of the facility itself, once this contact tracing is done and hopefully transmission has been limited, for the most part, if we're able to identify an isolated case and see who they've been exposed to, and there's not a thought that there's ongoing transmission, we have had facilities that are able to keep running without an interruption or without much interruption in their work. If a facility has had to be closed due to extremely widespread transmission, really the health authority is looking for that combination of measures to make sure that the transmission shouldn't be likely in the future. And this could include some combination of distancing, of PPE use, appropriate cleaning of the facility, policies to help people stay off of the line when they're sick. And again, there's not a one-size-fits-all list, but we do have guidance available for food processors and for other facilities, and more of these are coming from WorkSafe BC shortly to really give a template for what are the things that an employer can do to prevent transmission. So those are the things that we'd want to see in place for a facility to get it up and running. And for the most part, facilities we've been involved with have many things in place already. They've done these things just thinking of workplace safety. Seasonal influenza is something we've all wrestled with in the past anyway. So for the most part, these are not totally new concepts to employers. It's in many cases a matter of tightening up or enhancing existing procedures.
Thanks, Michael. Very helpful indeed. When we're talking about contact tracing, what are the steps involved?
Okay, so I mean, I could describe that from the perspective of the staff who would be doing this directly, and it really is. It's fairly intensive. We sometimes call it basically the shoe leather aspect of public health, because it's really can only be done by just directly talking to people and following, more or less trying to follow through their days what they've done. So if there's a new case of COVID-19, we know that the current science is showing that they are transmissible. They can pass on the infection when they have symptoms, and even we suspect when they have no symptoms, even 2 days before those symptoms develop. So if somebody is a case, they'll be interviewed in great detail about what their movements were, where they worked, with whom they worked, if they live with other people, pretty much trying to identify anyone that they may have had contact with during that period. The contact tracing aspect of it is in turn calling up those people, visiting them if necessary, and monitoring, trying to work with them every day to find out, have they had symptoms? If so, making sure that they can get tested for COVID-19, and if they haven't, then following them day by day, calling them carefully to make sure that they do get tested and that they continue to isolate throughout the potential 14-day incubation period. And this is one of the key breaks that we have basically on ongoing spread in the community. We have these overall social isolation or social distancing that we're all taking part in, which limits the opportunity for ongoing spread. And then more specifically, when there's a known case, really trying to wrap around that person and make sure that potential branching doesn't go forth and become many more cases.
Wow, very comprehensive. Thank you. If an asymptomatic worker comes to work with COVID-19, what is the risk of spread in a production environment?
So overall, the transmissibility is definitely increased during times of symptoms. I mean, this virus resides, it colonizes the body specifically at the back of the nose and throat, where basically we're coughing and sneezing from. So it needs a way to get out, and for the most part, that's going to be by a runny nose, by a cough, or by a sneeze. Other ways that it can be transmitted, though, are through speech, through shouting. There's been cases of outbreaks identified even in choirs because people are singing and effectively speaking quite vigorously in close quarters with one another. So a person without symptoms is able to pass the virus onward, although it's much more difficult than somebody with an active cough, for example. So definitely transmission is possible from somebody who's not having symptoms. And oftentimes we call these people pre-symptomatic because in the days before somebody becomes acutely ill with a cough, we've still seen transmission during those times. So it's important to be, in terms of contact tracing, always looking back a couple of days before someone became symptomatic to be very sure we found everybody.
Thanks, Michael. We've heard a lot about, over the news, of a second wave. How likely do you feel a second wave of infections may be this fall, and do you envision the response being any different?
Well, that's a really excellent question, and one that we're wrestling with in public health. I think a topic of major discussion from local public health right up to the highest levels in our provincial and federal governments, trying to understand what is the risk of that. At this point, we do have circulating COVID-19 in our communities, and although we have a lot of social distancing, we have closed restaurants and other social spaces, we've done a lot to prevent ongoing transmission. There's a risk of more transmission when we start to open those things up. And the possibility of a second wave has a lot to do with how much transmission starts to build up. If there's a large amount of circulating virus, effectively circulating infections in the community, and we start to see the conditions for spread, so people socializing more closely together, not having the social distancing that we've seen, if that goes too far, combined with environmental factors, the fact that people are indoors more, the fact that it seems influenza has shown us that some respiratory viruses do spread more in colder months, that is a a very serious risk. And it's been, I mean, I have limited experience with coronaviruses, but SARS in 2003 was a coronavirus, and we did see a similar pattern with a second wave in that case. So it is a major concern, and I think that making sure that we have measures that we can monitor closely what's happening in terms of spread and turn some of those measures back up a little bit if we need to. It's something that we need to keep that possibility in mind.
Thanks, Michael. Where should employers look for answers and help?
So employers, WorkSafe BC right now is doing a lot to develop resources for almost every sector, and I'm aware of some of the ones that should be out really quite promptly this week. They have some out already, and there'll be more for almost any type of workplace one could name. I would expect to see those. So that would be my first stop, is the WorkSafe BC website, and look for guidance that's specific to the sector, whether that's manufacturing, food processing, or other types of workplace. Those should be available. In terms of help with interpretation and implementing those, definitely your local health authority, Vancouver Coastal Health, is here for you, and that would be the same whether you're in Fraser Health, Interior Health, or other parts of BC. I should say Northern Health and Island Health as well. And I think that in public health, we'd like to let the public and employers know that every door is the right door, as they say. So if you call it public health and you're looking for direction, don't worry about whether you need to call WorkSafe or one department or another. We'll make sure that you talk to who you need to. So never hesitate just to reach out to your local public health department, which should be straightforward to find online. And as well as that, the good guidance from WorkSafe, I think, would be the main resource I would point people toward.
Thank you so much, Michael. This is such valuable information for employers and workers. We have some questions beginning to come in from the audience. To all of you, if you have questions, please submit through the chat window while we have Michael here with us. And if you'd like another set of eyes on your COVID-19 safety program or help creating your reopening plan, please call our email and call us for assistance. We have a team of health and safety advisors here. We'll be reaching out to all member companies over the next couple of weeks to check in with you, take advantage of our support to keep your people safe. So to start the Q&A, Michael, our first question is about contact tracing. If one of our workers tests positive, how long does it take to identify and notify their close contacts inside and outside our facility?
Yeah, great question. And right now at Public Health, it's sort of normally a 5-day-a-week operation, and we're very much in a 7-day-a-week calendar right now. So on any given day, when we have a positive test come from the lab, we're in touch with that person, I'd say within hours. And we get, at this point, really great service from the lab. If someone's tested, they have a result back within 24 hours for the most part. So if someone at your workplace has gone off of sick this morning, for example, and is tested right now, we'd probably be phoning them up tomorrow morning and going through identifying their contacts at the latest. We'd have that process started. Usually, we found with COVID-19, and maybe it's just the fact that this is something that's totally new to all of us. COVID-19, people have been extremely cooperative, extremely helpful, really trying to help out their contacts, whether that's their friends, co-workers, or other types of contacts. People have been quite helpful, letting us know who they've been in touch with, and as well as that, employers can as well. Sometimes people might know the first names, or they would of course know the type of work that they were doing, even if they couldn't name and provide contact information for every last person. So if the employer is able to provide staff lists related to different shifts or different work types, that is extremely helpful for public health in identifying who are the close contacts and making sure that they can in turn they can start self-isolating at home while we monitor them for any symptoms. So it's a pretty fast process. Sometimes, of course, as you'll all imagine, sometimes some people are harder to find than others. There's no question about that. But once we found people, we found that they're almost without exception very, very helpful and cooperative in this process, which really speeds things along and making sure that we've identified everyone who might be at risk.
Thanks, Michael. What are the most common symptoms of COVID-19?
Yeah, the most common symptoms overall, I would say, are what we'd call the classic symptoms that would include a cough. Typically, it's been described as a pretty bad cough too, often dry, not necessarily a wet cough, but a cough that most people who have had this symptom have said it's pretty hard to miss. Cough, sore throat, fever as well, and then some of those overall full body symptoms, constitutional symptoms, as we say, aching muscles and joints, overall a lot of fatigue, even young people, healthy people who are describing that they're really just completely flattened, aren't able to do much else. That's the classic picture, so a severe sort of flu-like illness. As well as that, though, we have seen some people who have symptoms of gastrointestinal illness, so things like diarrhea as their main symptom, or even their only symptom in some cases. So that's something that's been unique, and I think at the early stages unexpected with this virus. But that's something that we're also screening for quite closely. And of course, in most workplace contexts, we would absolutely be advising that someone with that symptom should not be at work in any case. Certainly, if it's in a food handling capacity. So those are the main ones that we worry about. Again, severe respiratory symptoms, but also sometimes milder things like that sore throat or even GI symptoms too.
Thanks, Michael. When is the time to shut a meat processing plant down? When there's one case, two cases? How do we know when to do this, especially in the early stages?
Yeah, so it's a great question, and I think in terms of getting the advice for how to run the plant in a safe way, WorkSafe BC and the Manufacturing Safety Alliance of BC are going to be great resources for running things effectively. If you have a case, I would say at that point, your regional health authority should be calling you, and if they haven't, call them, because that's exactly what we're there for, to look at the situation and give that advice. So if there's a single case, we would look closely at it, and if it's thought that somebody, depending when they worked, if what personal protective equipment might have been in place, what the nature of their work was, it's not a given that every single plant would need to close for a single case. So if you think of somebody who might be in a more administrative position, or somebody whose work is totally physically separate from others, or if the distancing measures were in place were thought to most likely have been successful, we might not need to close the plant. When there's some thought that there might be ongoing transmission, so as multiple cases or an unclear picture of what the contacts might have been, at those points for the safety of people involved and to prevent the outbreak from being worse still, at some points we've proceeded to closure in those cases. So it's a case-by-case situation, but I would say absolutely the regional health authority would be closely involved with that. In some cases, an employer might, out of an abundance of caution before they've worked with the regional health authority, say, that's it, we're not opening this morning, and we appreciate the good intent in that, but I would say overall you can rest assured that we'll be involved if we find a case in an industrial setting or a workplace setting.
Thanks, Michael. When would you suggest employers could consider opening a workplace gym?
Yeah, that's a really good question. I think that physical activity, employers that do have a gym have obviously seen the importance of physical activity for people's overall health. COVID-19 is not the only health issue that we have. Continuing to look at physical and mental health, including through prevention of chronic diseases like heart disease and diabetes and so on, are crucial. And at some point, COVID-19 might be with us for some time, and we're going to need to reopen things like gyms that promote physical activity. In Vancouver Coastal Health, we've never ordered gyms shut overall, although a number of commercial or public gyms definitely have closed in community centers or private gyms. We're trying to support them to reopen, so giving good direction on spacing, on frequent cleaning of surfaces, we would recommend. But definitely, we think that at this point in time, if you have a workplace gym and you can open it safely, we can give some advice on that. And we're actually putting together a document for indoor physical exercise and gyms to help with this piece throughout our region. That's something that should be on our own website very soon. But we would absolutely support employers, and that's something we're happy to talk through with you. Overall, you might need to look at the number of people who are using the facility at once. Definitely recommendations around cleaning equipment after handling it would be there. These are things that might be there in place, so people may or may not complete every single time they touch the equipment. So we totally want to tune up some of those approaches. But there's no reason that a gym can't be run with good risk mitigation in place.
Thanks, Michael. Very helpful. One of the questions I know that we've been asked quite commonly, and with the number of outbreaks in particular in the meat processing across Canada, as well as in the US, is there a common factor in the poultry or meat processing facilities that makes them more susceptible to virus transmission?
Yeah, a couple of things, and if going back to those main preventive measures, I would think that a couple of the things that might be at work are on the distancing side. By the nature of the work and the way that things are laid out in many cases, distancing isn't always implemented. It might not be feasible or possible, or it might be a great challenge to reorient the workplace to provide distancing. So in cases where people are working in very close quarters for a long time, there's definitely quite a high risk of transmission if somebody is symptomatic. on at the work site in those cases. And we've seen some of those hands-on and realized that plainly there would be a risk for transmission when you picture a large number of people close together. So ways to mitigate that could include expanding spacing. Definitely that's something to attend to, but then also that very top level of making sure that a person who is symptomatic isn't in the workplace to start with, and then you'll cut out a lot of the risk of introducing transmission into the site with those policies. And furthermore, having PPE in place. So this is we would recommend a mask for both for source control and for personal protection, so that if somebody does cough, does sneeze, that's going to be hopefully contained to some extent by the use of the mask. And of course, frequent hand hygiene is very important too in those cases. But I think that just the sheer proximity is a major issue in some of these cases.
Thank you, Michael. Can you force people off work if they seem to have COVID symptoms, but it may be allergies or something else?
Yeah, a challenging question, because some of these symptoms are not what we call non-specific in medicine. They could be caused by allergies, they could be caused by other respiratory infections, and overall there's definitely the challenge of saying, well, is this COVID-19 or is it something else if we're taking somebody off of work? I think in all cases, if somebody has respiratory symptoms, it would be reasonable to say that they should not be working in any case, whether that's flu or the common cold. We don't usually know what things are until they're tested, and even then we sometimes never know. So it's good advice to have people off, and I think that we'll see that more and more in different workplaces, that even for some symptoms that we might have historically worked through, I think that we'll see more and more people at least wearing a mask when they work with mild symptoms, and hopefully staying off entirely. In terms of allergies, I think that overall employers would be well placed to say, until proven otherwise, if there's a symptom, a respiratory symptom within your workplace, having that person stay off is the right decision. In some very specific cases where somebody has known allergies, they encountered that allergen that day, and they give a very clear story that it's an absolute certainty that it was a pollen or a grass allergy is the issue at hand. If it's responding well, if the symptom is reduced by antihistamines, for example, you'd have, I think, reason to believe that it indeed was allergies. But when in doubt, I think the right decision for respiratory symptoms is that worker is not at the workplace.
Thank you, Michael. What are your thoughts on taking employee temperatures upon arrival at the workplace?
The issue of temperature screening is very interesting. I think that it can bring benefits, and that somebody who does have an objective fever, a temperature read by a thermometer, 38 degrees or more, or 37.5, depending on the device, should definitely not be working, at least during the COVID pandemic, because that's a concerning symptom to see. One of the cautions I would say with temperature screening is it cannot replace the actual screening for symptoms themselves. So it should be a both of the above in terms of temperature screening, along with proactive symptom screening. So if a workplace has temperature screening and is also asking people at the point of entry about all of those symptoms that I had mentioned earlier, I think that that's an excellent screening procedure. Looking at temperature alone, we know that people will absolutely be missed in those cases. There's many people who might have the cough, they might be sneezing or have a runny nose and not have an objective fever. And if people get through fever, we do risk creating a false sense of security that worker is safe, and that they feel that they've screened without a fever in the morning. They might actually go ahead and work even with mild symptoms. So it needs to be both of the above in those cases.
Thank you, Michael. Very, very good information. If I walk behind a person, or if I go into an elevator after someone else is leaving it, I can smell his or her perfume. Does this mean that I can inhale the virus as well?
Yeah, really great question. And it's been, I think, one thing that has seen a lot of debate, especially, I'd say over the earlier months of the pandemic, the discussion of the question of airborne or not. And while the molecules that carry the scent of perfume or cologne are very small, very light, and can stay airborne for some time, we've probably all had that experience of smelling perfume, as the question describes, after somebody's left the space. the droplets that transmit COVID-19 are mostly small or even larger respiratory droplets, not airborne particles. So they tend to fall out of the air. They don't stay in suspension for a long period of time. So if you come into a space and somebody has already left it, there should be no risk of transmission in those cases. Again, the exceptions that I would describe would be these so-called aerosol generating procedures. So if somebody's working in hospital doing intensive respiratory procedures with a patient, that's another story entirely. But in terms of somebody being in an elevator, even coughing in that elevator, there should not be a situation where you could then inhale the virus afterwards.
Thank you, Michael. A lot of discussion around the world on PPE, and certainly here in BC. How effective are face shields?
Yeah, I think that they could be very important when people are in close proximity to one another. Again, there's this combination of different factors. So trying to make sure that people with symptoms, people who are infected, aren't in the area in the first place. Trying to make sure that people are practicing good cough and sneeze hygiene, covering their coughs where possible. But then in the instances where people might be close together, and it's not always possible to cover a cough with an elbow and so forth, there's going to be things that get through. So I think in those cases, there's no question that having a face shield, just that physical barrier, could contribute to the prevention of transmission. I think that it's important to keep in mind, you'd want to make sure, none of these things means that you can sacrifice the other things. So if a person is sick and coughing across from you, whether that's in any type of workplace, you wouldn't want to rely on the face shield to keep you well. It's again, applying these things in concert with one another is the way forward. But I think that absolutely a face shield or a mask could do a lot to prevent those respiratory droplets that I described from getting out. If somebody's coughing, there's an opportunity to block some of them. But I wouldn't say that that's going to be 100% protective.
Thank you, Michael. Another question along the same lines in PPE, are flat surgical or cloth face masks a good idea for general use in public or at a work where, for example, N95 is not required for this particular job function? We see differing opinions depending on the source of the information.
Yeah, and there's almost two questions with surgical masks or non-medical masks that people are using. Is it helpful from a personal protective perspective? So is wearing one going to prevent me from acquiring COVID-19 infection? And then also, is it useful for source control? If I am infected, will it be helpful for ongoing transmission? And it seems that in terms of protecting oneself by wearing a mask, that there's not great evidence that it has that purpose, because people can, even while wearing the mask, although it might prevent somebody from, and I hate to create this image, but if someone were to cough or sneeze directly towards you and you have a mask, of course, having your mouth and nose covered is going to make you safer in that instance. But it doesn't necessarily help with the droplet transmission, so contaminating one's hands and then touching one's face. And in some cases, there's been discussion that this might even lead people to bringing their hands to their face more often as they adjust their mask going through the day. So overall, for protection of oneself, the mask may not be that helpful. For source control, so if somebody is symptomatic, or even if they haven't realized they are infected or that they have just mild symptoms, it could be effective for keeping those droplets in, however. So there could be a role in situations, especially crowded situations, potentially public transit, when we're not able to maintain spacing, so bottlenecks in shopping areas potentially, things that we might not expect to come across, or in the workplace context where there might be areas where distancing can't be maintained, that having a mask on, if somebody is infected, could contribute to keeping those droplets inside and not expelling them where they can put someone else at risk.
Thank you, Michael. What are the most likely things or points in offices or plants where COVID-19 is spread? Water coolers, perhaps?
So areas where people might congregate and spend longer durations together seem to be the main risk. As I mentioned, it doesn't really take a long time in face-to-face conversation with somebody for there to be a transmission. So we've seen people who have symptoms and they weren't necessarily coughing, they weren't necessarily sneezing and appearing to be ill in a way that would be concerning. But we've had people with mild symptoms, say that I talked to Michael at the water cooler or sat across from him at the lunch table, and maybe that's somebody who needs follow-up. And we have had cases where that person in turn becomes positive just from that level of contact. So anywhere that people can be within that 2-meter bubble do seem to be areas of risk. So a couple of places that we've seen in workplaces have included locker rooms, change areas that everybody needs to go through, and the course of getting set up with their work clothes or footwear and so forth. Lunch rooms is definitely one. Naturally, we're all social people for the most part, and I think that that's an area of congregation where some workplaces have gone to say only 2 people to a table or created diagonal seating, trying to take measures to give people a little bit more space, or even opening up second or third lunchrooms within a facility just to say people need a place to take a break, but we're going to open up more space so that there's less crowding, or staggering those breaks as well so that it's not everybody having a break at the same time. These are some things to do about those. And then just any of these, again, pinch points, these bottlenecks where as people move into a work area and come off at the same time, if there's a lineup created where people need to stand close to each other for some time, engineering of that space or engineering of the time involved, so space to help space people out, can all be very helpful. So the example from the question of the water cooler, absolutely, people would be well advised, at least for now, to move along and try to have the conversation at some distance rather than clustering together.
Excellent, thank you. If an individual tests positive independent of the employer's knowledge and they don't want their employer notified, does privacy protection kind of override contact tracing?
Yeah, so there is a with the nature of our public health legislation is that people can be compelled to share information on contacts that they've had for the protection of public health. For the most part, and we've followed up hundreds of cases and moving into the thousands of contacts at this point, we found almost total cooperation from people, and not that they've needed to be asked repeatedly. The only times that we've had, sometimes people are hard to reach on their phone. People have said they don't check their messages a lot, and so forth. People have usually been pretty forthcoming, at least as far as we understand. We've been able to get pretty good information back from people. If somebody, in theory, if somebody was known to be transmissible and worked in a large workplace, and we can't get that information from them, sometimes we've taken unique steps and done testing of large groups of people who might have been contacts. So if someone was known to have worked for days with symptoms but couldn't, or either were unable or unwilling to name the specific contacts, we'd probably treat that entire group as potential contacts and monitor them closely. So that becomes a lot of work for public health, but we think that that's worthwhile if we believe any of those people might have been contacts.
Thank you, Michael. If a person has been positive, ill, and recovered, can they still be contagious? When can a person that has always been asymptomatic no longer be contagious?
Yeah, so right now with public health, and this is an evolving piece of the science to understand when does that transmissibility go away. Right now, if somebody has mild symptoms, we consider them to be cleared 10 days after those symptoms started, if those symptoms have gone away. And public health is involved with every single case. So they're not cleared, we'd like to stress, until public health says so, because there's often nuances. If someone has severe illness, if they have lingering symptoms, if there's some lack of clarity around when the symptoms started, the medical health officer or the staff working with us will be in touch closely. So the person will be told specifically that they're in that cleared state, and then they can come back to work. And we do set a bit of a buffer around that. We want to be very, very safe. So we're looking at the evidence of when virus is no longer shed, when transmissions have occurred, where this has been studied in large cohorts of people scientifically, to make sure that when somebody is coming out of isolation with their family and they're going back to the workplace and back out into the world, that when they're cleared, we have pretty good confidence that they're not transmissible. And especially with, we definitely say, if anything, raise that level of consciousness, whether that's in a long-term care context, in a food processor where risk of transmission might be high, we want to be extra careful. So we definitely apply a lot of caution to clearing people to go back to work.
Thank you, Michael, thank you. In a manufacturing environment, should we be limiting air fan use?
That's a I would say a topic of ongoing discussion right now. I think that for the most part, there doesn't seem to be too much evidence that air fans will spread things around. That if most of these larger droplets settle out of the air pretty quickly, so there's not too much of a worry of things being moved around by air fans. So we don't currently have a recommendation to suggest that. Looking at specific sites, sometimes we might see where there could be some risk depending on the configuration of specific fans. So it might be worth working with WorkSafe or working with public health on the specifics of that. But overall, there's no direction that we should be turning those off or redirecting them.
Thank you. What role do employers play in contact tracing if a positive case occurs in the workplace?
I would say that the background information that can be given to public health is hugely helpful. If there's a positive case, I think being able to proactively start to get together staff lists that would be relevant to contact tracing around that case is so helpful. I would say it saved us hours, even days sometimes, when that kind of list is available, because we then have the specific names, contact information, phone numbers, hopefully even second phone numbers to reach those contacts, versus having to, we'll always interview the case. Sometimes people don't have a perfect memory for who they've worked with either. So if there's lists of who would have been on at the same time, even people maybe not doing the same work directly with that person, but who might have crossed paths, pardon me, due to shift changes, that information is completely valuable to us. So that I'd say the employers can have a huge role, and as well as that, in some cases where it's difficult to reach someone through their primary phone number, oftentimes the employer has the closest relationship with the staff person. The staff person knows the employer better than they know public health in most cases. So it's often the employer that's able to find that person, let them know the importance of calling back public health. And we've had a lot of success where the employer stepped in and said, this is something that's going to protect your health and it's going to protect the health of your coworkers. So the employer being able to facilitate that initial contact can be really valuable.
Thank you, Michael. My facility usually offers tours to the general public. What should we be looking for before we begin thinking about inviting the public back into our plant?
What a great question. I would think that for tours, some of the same principles would apply for the function of the workplace. So trying to think of ways that the tour can be conducted while the group is practicing good spacing would be very important. So this might mean a smaller group. This might mean dividing a tour group into subgroups so that you don't have a large cluster moving around together. I think good information to the potential tour group, letting people know in the process of booking it, however that's set up, that nobody with symptoms should come. They should be proactive about trying to protect the health of the facility. I think that's very important, and even screening people at the point of arrival. So going, as I assume, with people signing in, maybe signing whatever documentation, waivers, etc., that they sign as they come through, making that symptom screen for visitors a part of it the same way you would for workers, I think would be very important. So at the very first stage, trying not to have infection, people who are infected coming into the facility at all. Practicing good spacing during the tour would be very important, and as well as that, doing, I think, the most possible to separate that outside group. Although they'll be seeing the facility in action, that's why the tour is happening. Probably making sure that they're not having too much direct contact with the workers, with the staff, and if they do, making sure that that's at a reasonable distance. So people can certainly talk to people about the work that they're doing and ask questions, but making sure that's unfortunately for most of us, it's probably not going to be at a handshake distance anymore for the time being. It might be it's got to be at 2 meters or more mark.
Thanks. Thank you, Michael. Another question on PPE. I've heard PPE recommended a number of times. What specifically is meant by this? As for the masks, the BC CDC in particular, the prevention poster they've created indicates that masks are not an effective measure to keep yourself safe from viral infection.
Yeah, and that's, again, overall the synthesis, the summary of what we've come up with in BC, and I think in Canada, examining the data, is that masks are not on their own going to be sufficient to prevent infection. They overall might, in some cases, add risk, in some cases diminish it, but it's not being recommended for the asymptomatic general population to prevent themselves from acquiring infection. can have a role in passing on it and prevention from passing infection from passing on in specific contexts where distancing is not possible. You'd overall go with distancing as I think your first tool against transmission. But in terms of protection of the individual wearing it, there's limited evidence around that. But again, when people are in close quarters, having masks could be a very good idea, and that you're going to be each person wearing a mask is protecting those around them from infection should they be infected themselves. So it's I agree that there's a bit of nuance to the communications about that. When somebody's wearing a mask, who is that protecting? And I think that's something, from a public health perspective, we'll continue to try to make sure the messaging is fine-tuned and that we're bringing a message that's relevant to the audience we're talking to, because the context of walking down the street is different than the context of working in close quarters with other people, of course. So we want to make sure that we're understanding where the recommendation we're giving is actually going.
Thank you, Michael. And then we all know there's been a lot of information around the N95 mask. Is an N95 mask considered adequate PPE with gloves for most work facilities where people have to interact?
Well, yeah, really, an N95, if anything, might be more than is required. A surgical mask that covers the face and mouth is what's usually discussed. Again, because the scientific evidence is not that this is an airborne virus. So an N95 mask that can actually filter out these very small particles shouldn't be necessary for prevention of the transmission of COVID-19. However, if in terms of the transmission to others, like any mask, it could help to keep these respiratory droplets in. The key thing about the gloves comments is that this can be helpful, but it's very important to stress with gloves that people still need to practice the same good hand hygiene, as we all know in this. I think in whether that's in the food sector or others, the glove does not prevent the hand from picking up viral particles in respiratory droplets. Taking that glove off can actually contaminate the hand, and if somebody brings that hand to their mouth or eyes and so forth, they can become infected. So really, the key thing, with even using those PPE that's described in this question, so the person involved still should be distanced from the people they're working with if possible, and adequate hand hygiene between interactions, before eating, and quite frequently through the day is really the crucial thing there.
Thank you, Michael. What do we mean by double bubble? Is this implemented? Does this apply in workplaces as well? What is the maximum number of people can be together for a certain meeting or gathering activity in a workplace?
Right. So in terms of what that means, and it's a really good question, because it's, I think, important that we are talking about and making sure that we all understand what's meant by these different phases that we're moving into as we reopen or as we relax some of the previous measures. So what's meant by that is the idea that for a long time now, for the last few months, we've all been told as much as possible to keep our contacts to only our household. This discussion of a double bubble might include increasing that envelope to include maybe contacts with another household, extended family that one hasn't seen for some time, potentially allowing for more contacts in that way. In the workplace, though, we're still recommending distancing. The maximum large gathering size of 50 was never meant to apply to workplaces. This applies to one-time events, things like concerts and festivals, other social gatherings like that. It's always been recognized that workplaces, many of them, had more than 50 people, will continue to have more than 50 people. So they should continue to practice good distancing within those contexts. I wouldn't say that workplaces should now be changing that. They should be keeping up the good distancing practices that have been put in. This is really a recommendation more on people's thoughts around the number of non-workplace contacts that they have. So the social contacts is what's being referred to there.
Thank you. There's been a lot of talk as well, the importance of mental health, which absolutely is critical. What are some of the best resources out there to deal with workplace anxiety from the worker's standpoint and also our own?
Great question. And a lot of this has definitely been recognized as this wears on, and I think does have impacts on people as we adjust to this this threat. All of us having a part in it as residents in BC. It does have a mental toll, and that includes for workers, of course. I think that there are some resources that have started to come out focused on healthcare workers, which is excellent because this has been the recognition of both the risk to those staff and also they're dealing in some cases with COVID-19 directly or fears around it in their patients. The mental health aspect of that has really been recognized, and there are some resources. There's fewer that I'm aware of for work in other sectors, but again, WorkSafe BC in developing some of their resources for different sectors has discussed this. This is something we've talked about as we start to put together resources to support industry. So this is something hopefully we'll see in time from bodies like WorkSafe BC, the BC Centre for Disease Control, and others.
Thank you, Michael. As we know, employees may go from one facility to another in terms of the manufacturing or food processing environments. Is an employee required to inform their employer if they have tested positive and were at the plant previously to testing positive?
It's a good question. Usually public health will lead to contact tracing, and that may in some cases involve contacting the employer. So the employer may choose to, but in no cases would we say they have to, and the contact tracing will hang on there doing that or not. So if somebody is a case and there's known that they might have had contacts, public health will look after contacting the employer. So we found in many cases employees quite diligently let their employers know, and the employer starts to think about who might have been exposed and then works with public health on that. But we would say that we really take on that responsibility as public health. We'll make that call to employers and make sure that people are isolated and quarantined as necessary, rather than putting that responsibility on the employee themselves, because in some cases we know that that person might be sick, they may even be hospitalized in some cases. So to make sure that loop is closed, public health in all cases will work with a workplace if there's any possibility of ongoing exposure.
Thank you very much, Michael. Many more questions, but we're out of time. Thanks,
okay,
everyone. If we missed yours, watch for the answers on our COVID-19 frequently answered questions page or call us to talk with a safety advisor. Please take our online COVID-19 safety assessment or call us to walk through the checklist and create your restart plan with a safety advisor. If you have any other questions, please contact our Occupational Health and Safety Support Hotline or reach out to us through our website anytime. Thank you for joining us. Thank you very much for being part of our webinar today. Please quickly share your feedback and suggestions in the brief survey in your inbox. We'll follow up soon with the wrap-up email that includes a recording of the webinar and links to our slides and related resources. Feel free to share these and follow us on social media for more news, resources, and future events. Thank you all.